Hi, this is Dr. Benzinger on health with secondopinion.org. Secondopinion.org was dedicated to one purpose, helping you learn how to take care of yourself and empowering you as to prevention of disease, and if you unfortunately do suffer from one, as to what you can do on a conservative realm to again feel like you are engaged in helping yourself maintain your health. Will you choose to control your future, or will you choose to allow the disease to control you? Today's coverage is on diabetes. Short vignette that you can send to family and friends to try to help them understand diabetes better and look at all the options in short order. And today, if you want further information, go to secondopinion.org. You'll get a lot more. But what we do know is about 15.7 million people in America have diabetes, and diabetes and its complications are the sixth leading cause of death and primary cause of blindness between the ages of 20 and 70 years old, which is huge when you look at blindness being driven by this thing. What we know is we don't really want to see our blood sugar above 100. We want it to below 180 even after we've eaten. And now those scales have continued to wind back, and a glucose tolerance test, we know that that test itself is a great test for screening diabetes, but there are other more advanced tests, since we've cut this, that I think you should look at when your doctor considers diabetes as a consideration for you. The A1C is another test, and there's several others. Diabetes is frankly a carbohydrate metabolism disorder, and there's multiple types, type 1, type 2, gestational, and a few others that we're going to try to cover in short order. It can cause death, it can cause blindness, and shouldn't be ignored. Be aware of the signs immediately, at least of type 2, and learn how to eat right, exercise, and take appropriate supplements to help yourself. When we look at the diabetes mellitus itself, we know it's a disorder of carbohydrates, okay? And if you haven't gotten our carbohydrate seminar, please download that, watch it. It will help you. It's characterized by something called hyperglycemia. In other words, too much sugar in your blood, which can damage lots of other types of things. And it results in an inability to convert, use, metabolize, or dispose, or use glucose or sugar in the body itself. The different types, type 1, affects about 5 to 10% of the people with diabetes, usually occurs early age, usually before 30 years old, and is usually autoimmune based. Something went wrong with the immune system and decided to start attacking itself. Some experts believe that may be the result of an immune response after a viral infection of some sort, but there are lots of theories out there. Type 2, non-insulin dependent. I don't know if that's quite true, but that's what they say it is. Adult onset diabetes is the way to look at it. It's up to 90% of the population, the adult population with diabetes. Usually begins later in life. Although frequent in younger adults, and the effects are continuing to increase as to how early people are getting diabetes. The signs and symptoms, family many times will have it, so you have to watch it then. Obesity, eye problems, protein or sugar in the urine, glaucoma, delivery of large babies could predispose you. Numbness or tingling in the hands or feet, fatigue, need to go to the bathroom frequently, always thirsty, change in appetite, irritability. Some of us would think that some of that mostly with the irritability, would be everybody has diabetes. And some days it seems like everybody's got diabetes, but that's not quite true. Increased thirst and blurred vision might be a sign of it. Easily screened for, it just needs to be checked. Gestational just means, hey, you get the diabetic signs during pregnancy. Some women will only get it during pregnancy and never develop it later. However, many, they find, if they have it gestationally, are predisposed to it later in life and really should work hard on it from that point forward. Okay? There's also something called impaired glucose tolerance. It affects 11% of American adults, and blood glucose levels are normal, but aren't diabetic levels, but they act as though they have diabetes. So about 7% of people are IGT, and they go on to develop type 2 diabetes. Why? Because they fit within this normal standard number, and people don't think that they are diabetic. So sometimes we have to pay attention to the symptoms even greater than we do the test to follow up. So persist with your doctor. If the tests show normal, but you really see that you have all these symptoms, you might be one of those type of conditions called impaired glucose tolerance patient. Okay? And back then, I'm telling you, 10 years ago, they totally ignored it. Now they're getting more aggressive of seeing that that can happen and getting people on diets a little bit earlier. Okay? Insulin resistant or syndrome X affects more and more people today. Plenty of insulin made by the pancreas, but cells are resistant to using the insulin, so you end up with excess blood sugar. Okay? Insulin, just so you know what it is a hormone that's released by the pancreas, controls the amount of sugar in blood. Okay? Now, what's interesting is this. We need approximately 2 teaspoons of sugar to run the entire body. 2 teaspoons. Not tablespoons. Not an entire soda with 10 teaspoons in it. We need 2 runs the whole body. The amount of sugar that we put in our body itself and keep challenging this insulin over and over and over until we burn out the pancreas itself is so frequent, it's ridiculous. We just have to decide, do we want to predispose? And if we've already got it in the family, you should be aggressively addressing this right now. Okay? So the other thing I'm going to mention, there's also another hormone that's secreted by the pancreas. Glucagon. Its primary job is when you don't have enough blood sugar in your bloodstream because you haven't eaten for a while, glucagon goes to the liver, creates a chemical change, which then goes out and actually breaks down fat, which many of us want, to come back to the liver, break it down, and make blood sugar come up to normal so that we can continue to burn. Guess what? If we're burning out our pancreas already and our insulin is a problem, we probably are burning out our glucagon, and our glucagon is the thing that probably keeps us slim and trim and wonderful. So the problem is you keep burning out the pancreas by bad dietary choices and other chemical exposures, likelihood is glucagon is going to go away too, and so is your wonderful figure. Okay? So what can you do? Points to wellness. Drastically reduce the concentrated carbohydrates, simple sugars. I like the glycemic index sheets. I think that they're very valuable, more so for women than men, but women and men should follow low glycemic food groups and stay away from high glycemic foods. That's healthy in my estimation. Aerobic exercise 20 minutes at least 3 times a week at a limited amount. Okay, that's just limited. Anything beyond that would be what I'd like to see, but that's just don't get below that. Gradually, you want to lose weight. You don't want to go in and try to drop 30 pounds in a month. It's just silly. You're going to hurt yourself, and it's not going to help you. Limit your fat content to 30% per day maximum. Use 30 grams of fiber daily, even if you have to take it with Metamucil or in form like that. It's worth having it because it really helps your carbohydrate metabolism. Eat small meals, 6 small meals, about fist size, all day long. And maintain well-managed supplementation program to optimize glucose and insulin controls. Okay? Here are some of the herbs that we found that have been very successful. You'll see right in the top it says cinnamon, cinnamon, and cinnamon. Why? Because cinnamon is a big deal. If you've looked at our reviews of 2 books, the Diabetic Survival Guide and Diabetes for Dummies, excellent authors, all are raving about what cinnamon does for you. More cinnamon you take, the better your blood sugar gets, okay? B-complex, vitamin A, C, and E, vitamin D, special note I make because it really seems to be affecting blood sugar as well as many other things, vitamin D, okay? And zinc. When we look at other supplementation, essential fatty acids help control swelling and inflammatory problems that occur with people who have sugar metabolism problems. So omega-3 oils, fish oils, are really recommended as a supplement. And here's some other considerations. Fenugreek, what's it do? It reduces blood sugar and helps your cholesterol. So if you've got those 2, fenugreek might be an herb that you want to consider. Chromium picolinate improves the insulin efficiency. In other words, whatever you do have, it makes it more efficient. Okay? So that might be something to consider. And I like chromium in these cases. I like chromium, I like cinnamon. Garlic stabilizes your blood sugar levels. L-carnitine helps mobilize fat. Keep your blood sugars level and keep you a little slimmer. I like carnitine. L-glutamine reduces sugar cravings. For you that are predisposed to that now, use this type of stuff to stop yourself from moving into a diabetic state. And taurine, it's a protein. It aids in the release of insulin. So taurine and fenugreek, taurine and chromium might be combinations if you know Your predisposition to sugar handling problems is great, with cinnamon packed on as heavy as you can get it. Cedar berries are excellent nourishment for the pancreas, so if you're trying to heal the pancreas, cedar berries should be considered. Juniper berries found in lower blood sugar, they seem to help lower it. If you're really high, nothing seems to be helping, and you want to try to get it under control yourself, try juniper berries in a pretty high dose if you're not already on medication to see if that helps. Bitter melon and the gymnasium is actually another Ayurvedic medication that seems to help regulate blood. You can try these individually or together in a unit type of a supplement and see if any of those help. Ginseng lowers blood sugar, but don't use ginseng if you have high blood pressure. And huckleberry helps promote insulin production. So there's several. If you intermix them appropriately for your special needs, you might find something that you can use to help yourself with diabetes. So the question still is, will you choose to control your future, or will you be controlled by the disease, diabetes? Hope you've enjoyed today as to kind of a short vignette, but kind of some insight into diabetes and alternative options that you can start practicing immediately that might help you stay away from this condition or help yourself with the condition you have. This is Dr. Benzinger on Health with secondopinion.org. Join us. Sign up for our free newsletter so you can stay in line with the new information that we come out with from those experts that you want to hear from. This is Dr. Benzinger. We'll look for you next time, and may God bless you.